Most of you that have watched any of my videos would probably believe that I love supplemental plans and that everyone should get one. And that's really not true. In fact, I'm going to show you in this video 5 reasons why you shouldn't get a supplemental plan. Now, I'm going to show you those 5 reasons why you should not get a Medicare supplemental plan. But just before I do, I just want to do a quick review to make sure that you're clear on the 2 different ways in which we use Medicare benefits. Okay, one way is we can choose to stay in original Medicare A and B. When we do that, that means that Medicare pays first. But because of the gaps that exist in Medicare, most people get some kind of a supplemental plan to fill in the gaps, either fully or almost in full. And then we also add for our prescriptions a Part D plan. So that's one way we can use our Medicare A and B with a sup and a prescription drug plan. The second way is to do what's called a C plan, or they're referred to as replacement plans or Medicare Advantage plans. All right. These are the 2 systems. You cannot be on both at the same time. It's one or the other. Now, the only thing that these 2 systems have in common is you've got to be enrolled in Medicare A and B. Now, A is free for most people, but B has a premium. And the B premium right now in 2023 is $164.90 a month. Comes out of your Social Security check, or they bill you for that quarterly. If I have an Advantage plan, same thing applies. I have got to be enrolled in Medicare A and B. I got to pay my B premium. Now, keep in mind, as I share these premiums, this is for anyone who's a modified adjusted gross income as a single person is $97,000 or below. If you're a married couple, $194,000 or below, this would be your Part B premium. If we're above those numbers, then you'll pay additional amounts for your Part B premium. I've got plenty of videos on that, and you can find those. Okay, but the point is, we're enrolled in A and B. That's the only thing they have in common. Beyond that, the 2 totally different systems. So what happens in A and B, Medicare pays first, but Medicare doesn't pay for anything 100% other than preventive services. So in A and B, I've got gaps. Okay, I actually have 3 gaps on the A, and I got 3 gaps on the B of Medicare. Those gaps, I'm financially responsible for those. Those would be deductibles and co-pays and the possibility of excess charges. And so I have to pay those. So most people don't want to be responsible for those 6 gaps, so they can transfer that liability to an insurance company. If you're watching this video, that means that you probably have some decisions about Medicare that you're going to have to make. We upload 3 videos every week so that you'll have the information and the education that you need to make right Medicare decisions and avoid getting stuck with penalties and bad coverage. To make sure that you don't miss out on any of these crucial topics, click the subscribe button below, then turn on notifications. Have a blessed day. They can transfer all the liability through an F plan. Now, in order to get an F plan, though, you have to be born before January 1st, 1955, or you're not eligible for an F plan. So again, some people can't get F plans, but it is a full coverage plan. It covers 6 of the 6 gaps. The next plan below, that's a G plan. G plan covers 5 of the 6 gaps. The only one does not cover is the Medicare B deductible. This year, that's $226. So you would pay the first $226 of all Medicare billing. After that, you have 100% coverage the rest of the year. Medicare pays, the G fills in all the gaps but the B deductible. Another plan that some people go with is an N plan. It covers 4 of the 6 gaps. You would be responsible for the B deductible, and you would also be responsible for excess charges if and when they occur. That's when a doctor adds to the bill 15%, and then you would also be subject to co-pays every time you went to a doctor up to $20. So obviously the N plan is going to have a lower premium. You're just taking on a little bit more of the gaps, a little bit more of the liability. Okay, now when we stay in that system, then we add a prescription drug plan to our coverage. The average right now in America is about $30. So we pay our B, we pay the premium for our G plan, and or N, F, whatever you're going to buy, and then we have a prescription drug plan. Now again, I'm just going to mention this real quickly. When it comes to G plans right now, the average is going to be about $125 to $150 on a monthly basis. Now, I know there are states that's going to be lower than that. States are going to be a bit higher. But as a general rule, that's going to give you the range for a Plan G. That's the most popular today. So we have our B premium, our G premium, and we have to pay for our drug plan. That's going to be around $300 and maybe $325 a month. And some choose that option. I'm going to show you why you shouldn't, though, and instead go with the other option, which are called Advantage plans. Now, what happens here, I have to, of course, be enrolled in Medicare A and B, but now this plan is going to be different. What I'm going to have now is I'm going to have a network of doctors and providers, different services that I'll get through the network. Those are either HMO networks or PPO networks, right? In addition to that, what I'm going to do, instead of paying a premium, I'm going to pay co-pays out of my pocket. So if I go to the hospital, I'll pay copay, get an MRI, I'll pay a copay, have an outpatient procedure or labs or something, I pay as I go. So I have copays until I hit what's called the max out of pocket for the year. So once I hit my max, maybe $4,000 to $7,000, then I can put my wallet away, my checkbook away. I don't have to pay anything the rest of the year, and then that will reset again in January. All right. Now, the reason that people like these is because most companies have a zero premium plan. Instead of paying a premium like you did on the supplemental side, we had a zero premium for the plan, and instead we pay as we go. So we just take on the risk of some of those copays. But again, the nice thing about these plans is they also have lots of perks. A lot of perks that the system over here doesn't have at all. Typically have a gym membership, maybe Renew Active network or Silver Sneakers network. They'll usually throw in a dental allowance, a hearing aid allowance, eyewear allowance. Sometimes over the counter, you can get over the counter benefits. They will give you a credit, maybe $75 to $90 every quarter. You can get things you typically in a drugstore and order those, and they'll ship those to your home. And sometimes you can even see a reduction in your Part B premium. So this is the plan that has all kinds of perks. A lot of people will like that particular system. All right. And so these are the two ways in which I can use my Medicare benefits. And so in this video, what I'm going to show you is why I wouldn't choose this side over here. Why I wouldn't choose that F plan or that G plan or the N plan. And rather, I would just choose that C plan because I believe that is going to serve you better. So let's talk about who shouldn't and why should you not get a supplemental plan. Well, number one, just simply because of finances. It could be that you can't afford that extra $150, $175 a month for that supplemental plan and that drug plan. That just doesn't fit in your budget. You can't afford that. Then I wouldn't get a supplemental plan. It's not in your budget. Don't do that. You can't live beyond your means. Now, some of you could afford it, but you don't want to afford it. You just simply do not want to allocate money towards that. You would rather have the risk of taking on the copays and the max out of pocket. You can handle that. And so if that's you, that's a very good reason to not get a supplemental plan, just simply finances alone. The second reason I would not get one is this. Let's say that you are physically fit, you are perfectly healthy, you're doing everything you can to stay that way, and you believe that you will be healthy the rest of your life. In other words, you have that crystal ball and you look into the future and you realize, hey, I'm taking care of myself. I'm never going to get cancer. I'm not going to have some kind of serious heart issue, or nothing's going to happen to me that I think I'm going to warrant spending the money to get that supplemental plan because I think everything's going to go well for me. And if that's you, and I've met plenty of you just like that. In other words, you're very confident, you are healthy, and you're going to stay healthy. Again, then don't spend the money on that supplemental plan. Just take an Advantage plan. It has a zero premium. You'll take on the risk of those copays, but again, it's not going to break the bank because all those are going to have a max out of pocket. So if you're physically fit and healthy, you're not worried about it, then get that Advantage plan. There's a third reason why I wouldn't get a supplemental plan, and that is if you really are going to benefit from all the perks that are offered by that Advantage plan, meaning your gym allows you to go there at no cost, so you don't have to pay for your gym membership. You do want hearing aids, or you like this fact that you get $200 a year towards your contact lenses. And so some of the perks like the over-the-counter card or maybe the Part B reduction that comes with your Advantage plan, those things are very, very important to you. And they're not available with original Medicare with a supplemental plan. So if you like the perks and that's your focus, then go ahead and get that Advantage plan. The fourth reason that I would not do that is because you live in an area where they are very attractive, which means the Advantage plans are very attractive. And really the best example of this would be Florida. There's other parts of the country beyond Florida, but in Florida, those Advantage plans are very attractive. Almost all of them have a zero premium. Your copays are very low, lots of zeros, plus the max out of pocket is $1,000 a year. And so that's the most you'd spend because there's so many people on those plans in that area. It's very, very attractive. And if you live in that kind of area, I wouldn't blame you for looking very seriously at an Advantage plan. Now, keep in mind, you still have the issues of networks and pre-authorizations and maybe being on one permanently because you have to medically qualify to get off. But again, I think those nice plans far outweigh some of the disadvantages that I just mentioned. So the point is, if you have very attractive Advantage plans, that would be reason enough to just look at those alone and not pay the premium for a supplemental plan.
Hey, if you're confused about Medicare and really just looking for someone to guide you through this entire process, we would love to do that. Our services are always free to you. We have a team currently that helps about 1,000 people a month. That helps people go from just Medicare confusion to having their plans. And this whole process takes like under an hour. I mean, it's really pretty quick. So we'll help you enroll in Medicare, choose between a Supplemental Advantage plan, find drug coverage, and then help you do all the tricky government forms and enrollment paperwork. If you want help with this, you can go to the pinned comment below this video, and you can schedule a call with our team. You can also call our 800 number, and we'd love to help you.
And then the fifth reason and the last reason is this: because you have other options. In other words, you don't need a supplemental plan because you have other options. Let me mention those to you real quickly. Number one could be retiree plans. Hey, I've seen a lot of retiree plans, even union plans especially, that are very attractive. And so you can get that retiree option secondary to Medicare at a better price than what you can with the supplemental premium. And again, if that's you, then weigh those two together and see if that retirement plan is better. Then I would not get a supplemental plan. Let's say you served our country and you were in the military and you're eligible for VA benefits, meaning you've jumped through the hoops that are necessary, you've done all the screenings, and they say you're eligible for X amount of VA. And if it's a nice, attractive package for the VA, I would not get a supplemental plan. If you like the VA and you're comfortable with that system, then again, supplemental plan probably would not be a good way to use your money. You're going to go to the VA anyways. And so what I would do in that situation is I would get what's called an MA only plan, Medicare Advantage only. And you get your prescriptions from the VA. You can go to the VA when you want to, but then you can use that civilian Medicare Advantage plan only. So there's no drug component in there. It's just that in and outpatient. You can use that at your discretion and you get a zero premium. So again, if I was a veteran, would not get a supplemental plan. And then if you are someone that not just served our country, but actually retired from the military, you qualify for benefits that are called TRICARE. You're on TRICARE now, but once you hit 65, you'll be on TRICARE for life, which pays second to Medicare. That's why if you're on TRICARE, you've got enrolled in Medicare A and B at 65, and then TRICARE will pay second. And it's wonderful insurance. Frankly, it's very similar to that supplemental plan app because you have 100% coverage. And so if you have TRICARE for life, I would not pay the money for a supplemental plan. It would be a waste of money in my opinion. You're going to be overinsured. Now, I would tell you that a lot of TRICARE people today are also doing like the veterans. They are doing MA only plans because you get your prescriptions through the TRICARE for life system, that pharmacy benefit, and then you get all the perks of that Medicare Advantage plan. And many times you even get a Part B reduction. And so TRICARE will coordinate with the Medicare Advantage plan just like it will with original Medicare. So many who have TRICARE for life are doing that today. And then lastly, anyone who's retired from the federal government. I mean, you were with the Treasury Department or Homeland Security or the FBI or IRS, and you have eligibility of federal employee health benefits. And so again, I wouldn't get a supplemental plan, number one, because if you do, you actually have to fill out a paperwork, send it to OPM, and you have to terminate your FEHB options. And that termination is for life. So I would not do that. That's what's required if you get a supplemental plan. But you also get an Advantage plan, which means you can suspend FEHB or do like the vets do and TRICARE for life people and get an MA only plan. Get your prescriptions through the FEHB system and then take advantage of all those perks that come as an option for you for those MA only plans. So folks, though I like supplemental plans for sure, those of you who follow me on YouTube know how much I love them, but there are times when absolutely I would say I would not get a supplemental plan, especially in these particular situations and for these reasons.